My name's Dr Majid Akram. I'm a general practitioner in Market Deeping at the Deepings Practice in South Lincolnshire. I work in a large size practice, 24,000 patients in a semi-rural location with 15 GPs, 9 nurses, dispensers, allied health professionals, nurse practitioner, and now our extended scope physiotherapist. In 2016-2017, we conducted an audit over a 1-week period looking at what our clinicians in the building were seeing face-to-face. And interestingly, what we found is that around 22% of our face-to-face contacts on a weekly basis related to musculo-skeletal problems. We had potentially found a segmented section of our GP force's workload that we thought we might be able to transfer to another clinical professional. Our local CCG agreed to fund a physiotherapist for a period of 6 months, and in doing so, together we would try and establish whether there was a return on investment in relation to this service redesign.
Hi, my name's Phil Richards. I'm the musculo-skeletal practitioner at the Deepings Practice. The benefits for patients is they get early access to musculoskeletal care. We get longer appointments in the GP as well, so especially with like chronic musculoskeletal conditions, a lot of patients need the time and understanding about the condition, which the GP doesn't always have that time resource to give, so that can be really helpful for our chronic patients. In terms of things like injection therapy, they don't have to wait for a routine GP appointment. If the GPs even do the injections, some patients will actually travel to secondary care, which is costing a consultant or a hospital appointment. They can come and see me that same week and have their injection for a lot of conditions. They get access to the routine imaging, analgesics, everything just a lot quicker. And it's just overall been very successful. We've had great feedback. I think also actually enriches the GP's knowledge of musculoskeletal care. I do training for them and I have discussions with them, and they still see a lot of musculoskeletal patients, so I think it just kind of boosts the specialism and the generalism for me as well.
So I think overall this is a really good example of a win-win-win situation. So it's been a win for patients. Patients can see our musculoskeletal practitioner within a couple of days, if not within that week. Every time a patient sees a musculoskeletal practitioner, it frees up a GP appointment, so actually it's very good. The other win has been for the practice itself. So on average, the musculoskeletal practitioner is able to see around 350 to possibly 400 patients on a monthly basis. We have been able to shift around 40% of our musculoskeletal face-to-face contacts from GPs to the musculoskeletal practitioner. And actually, the other win is the system win for the CCG and the wider health economy. So we have been able to reduce outpatient elective activity, actually standardising care and actually channeling it through one individual has enabled us to reduce the cost of investigations and inappropriate investigations. And actually, interestingly, the physiotherapist is actually promoting self-care in a better way because he has more time with these patients. So actually our prescribing costs have gone down. I think the pilot's been fantastic in that it's allowed us to modernise and reform the way we deliver musculoskeletal care for our local patient population.
For me, it sounded really good on paper, but I was really interested to see how it would work. And I think it's worked actually really, really well. I would thoroughly recommend it nationwide. I think it's just overall been a great service to people.